there's sort of some classic symptoms that belong to the group of inflammatory bowel diseases. I should note that IBD encompasses or is an umbrella term for two specific disease states. One of them is ulcerative colitis and the other one is Crohn's disease. We used to think of them as two very distinct buckets, mainly because Crohn's was originally found actually at Mount Sinai by Dr. Crohn's and his colleagues, Oppenheimer and Ginsburg, first reported in 1932 and called regional enteritis. So it was really terminal ileitis just at the end of the small bowel. And then it evolved to show that Crohn's could actually occur anywhere from the mouth to the anal canal. What's different versus ulcerative colitis is that ulcerative colitis is restricted to the colon. There are probably, since there's a lot of genes and a lot of bacteria and a lot of environmental factors, there are multiple kinds of Crohn's and there are multiple kinds of UC. And as we start to understand the genetics around it, we start to see that these two historically distinct subtypes are probably closer than we thought, especially in the fact that there's a group of patients with Crohn's disease that have disease isolated to the colon. So somewhat of a Crohn's colitis, which looks very similar to ulcerative colitis. So people confuse the terms. And what I think the direction we're going is, let's start with, where's the disease located? Forget whether it's Crohn's or UC. Is it colon only? Is it small bowel plus colon? Is it small bowel only? And then you choose your treatments more so based on location, because location drives symptoms. So someone who has colon involvement or colitis typically has urgency, which means a rush to go to the bathroom, rectal bleeding, bowel frequency increase, so more trips to the restroom, cramping associated with a bowel movement, often relieved after a bowel movement, and also sometimes when they eat, they have to run to the bathroom. So there's this distinct colon inflammation that you can sort of get a feel from when you ask a patient their symptoms. You can say, oh, that's classic left-sided colitis symptoms, and we treat accordingly. That's sort of an easier colitis kind of description. And some patients wake up at night as well. So it really impacts the quality of life, especially with urgency. On occasion, there's accidents because you can't find a restroom or make it in time. So it's very impactful. Talk about quality of life, which was sort of one of the questions is, how do these diseases impact the quality of life? I'll tell you that colon inflammation really affects someone's life, because often they're in the bathroom in the morning. It's hard to get out of the house because they may run to the restroom, think that they're finished, stand back up, and have this sense that you have to still go. We call that tenesmus, which is incomplete evacuation. And it's sort of this spasm of the rectum. That's extremely stressful. Not to say that Crohn's symptoms are not stressful and impact quality of life, but they're different, because the small bowel is where you absorb your nutrients. Often the distinction also between Crohn's and UC is that Crohn's affects all four walls of the bowel, versus ulcerative colitis only affects the inner lining, which is called the mucosa. So because Crohn's can affect all four walls, inflammation in all four walls creates somewhat of a constriction. And so patients have pain with eating because there's sort of what we call swelling inside the bowel, but also the ulcerations, which is when you go in with an endoscope and you actually find these ulcerations, they could be quite deep with Crohn's disease. With UC, because it's just the inner lining, it's sort of like smattering of, almost like raw, sort of a sore throat, continuous inflammation from the rectum, head north into the colon. With Crohn's disease, they look different. They are typically almost like you've sort of taken a rake and sort of have these linear ulcerations in the more complex forms of Crohn's. So abdominal pain, weight loss, fatigue, anemia, so patients lose iron through their stool. Alternatively, also, they're just not absorbing their food and they're not absorbing their iron. And abdominal pain and change in stool frequency are sort of the characteristic patient-reported symptoms that we get. And with UC, it's more stool frequency and rectal bleeding are the two main factors. So those are what we focus on when we ask for symptoms. And that's actually where, even in drug trials, those are the symptoms that we are looking for to say that these drugs work. So those are important symptoms. One thing that affects the quality of life significantly in Crohn's patients, which again differentiates it from UC, is the fact that there's something called perianal disease. So perianal fistulas, abscesses, ulceration, fissures, and obviously that's very painful to have, a sort of a fluid-filled collection of infection in your bottom area, often requiring surgery for drainage. Then they could have constant drainage through these tunnels, or what we call fistulas, around the anal canal area. And what's interesting also about Crohn's is that because it's all four walls, the way that the body tries to heal itself is by creating scar tissue. Now that's okay when you have a wound on the outside. You want wounds to close, you want scars to develop. Not so much in the intestinal tract, because again, as you get inflammation, the body sort of heals by itself in a sense. Maybe we're not providing enough biologic and anti-inflammatories to them, and the body starts to create scar tissue. So not only do you have inflammation that constricts the lumen of the bowel, you also have scar tissue. And that could result in bowel blockages, for example, and patients have a lot of pain. They can also have these tunneling that we describe around the perianal area. They can have it in the bowel wall because of the four walls, and then things get complicated. And so our philosophy is explaining to patients what's the natural history of your disease and why we need to focus on getting the right therapy.